Hey Leslie,
Hello.
how are you doing?
Good. How are you?
Pretty good.
Good.
You
I'm
guys
I'm just
got any white stuff yet?
we got some the other night, but it the grass got like it stuck to the grass and the trees a little bit, but it melted off the road and the sidewalk. So mind you, we were just on the verge of it, like Calgary and some of those they really got a nasty storm.
Well, yeah, we haven't gotten any, thank God, but
Yeah.
it's not far from us. I know we were talking about going to Yellowstone and they got pounded and Glacier got pounded. So a lot of the mountain areas, Spokane Mountain got some snow at the top, and that's here in Spokane. So the higher elevations have gotten it,
Yeah.
Yeah.
Yeah, it's just a matter of time. We've got some nice weather forecasts for a week, but it can change in the blink of an eye. So
Yeah, yeah, we've had some cool mornings. We've had last 3 days sub freezing.
yeah, we have too. Yeah, it's been down to, oh, I don't know, well, in Celsius, like -6, -7, which is, it's cold enough to freeze the plants, but
Yeah, yeah.
anything that's close to the house has been okay. So, but eventually,
Well, let's keep our fingers crossed that it'll hold off as
yeah,
long as it will. Hey, Elizabeth,
yeah.
Hi there.
how are you doing?
Good. It's certainly
Yeah.
not cold in Houston.
Not cold in Houston? No. No, no. My son lives in San Antonio and he always keeps me apprised of the weather. I think I talked to him last week and he said it was 97 degrees, so no
Mm,
fun.
yeah,
That's why I left
that's
Texas. That's exactly why I left Texas. I just could not, I got tired of the heat. It's just too much.
Yeah.
yeah.
No, I
When
hear you. It
when I
is.
grew up there, we might have 5 days a year that it was above 90, and now they get 25 days in a row above 100. So it's crazy.
It is. The
Recording in
weather has
progress.
definitely changed.
Sorry, that was me. Okay.
Oh, Dr. Thomas, I heard
Yes.
back from Jeanette at Awakenings.
Oh, yeah. Did you?
Yeah, and she's gonna do a virtual appointment with me.
Oh, good.
Yes.
She's really good. I've used her quite a bit, and her her she she is really good with herbs. Really good.
Good.
She's outstanding. Um, I used to get a lot of people that would ask me, because I would work on their pets, and they would say, "Oh, well, we want to get it for ourselves. So who do you recommend?" So I'd say, "Well, what are you dealing with?" And if it was something that I thought that acupuncture would be the best, then I would send them to a guy named Howard Lee. But if it was somebody that I thought herbs would really help and everything, then it was always Jeanette because she was always the best. Because she
Oh,
would
I'm
say when I
excited.
would go in and we'd be talking and she'd be gonna mix up some herbs and stuff. She'd say, "Well, do you want to get an acupuncture treatment today or not?" So it was kind of her what I think herbs are her primary go-to. So yeah. But she's
Yeah.
outstanding.
Well, and she was willing to do it virtually too. So, I was thrilled to hear that. I had gotten a little bit desperate and I found this person locally that seemed really nice, but like the more I researched, I really don't know like if he's really trained or if he's not. Like it kind of seems like he's got a bunch of different companies going. And anyway, in the meantime, I ordered his herbs. And so she was like, "Well, don't worry. Send me a picture of what you ordered. Like, I'll take a look at it." She was really
Yeah.
lovely.
Yeah. And one of the things I liked about Jeanette's expertise is that she rarely uses uh what do I want to call them? Formulas that are pre-made. Like I've got some herbs here on my desk, like this is an herbal formula by Sun 10, you know. And so she rarely will send you home a bottle of herbs like this. It's got, this may have 10 different herbs in it. She goes back and she starts her, I call her witch. She starts putting her herbs together and she makes up her own formulas.
Oh, I
Yeah.
can't wait. I'm so excited. I knew like, okay, I got a little impatient. I ordered something. And if I just like stop for a second, like it will all work out. And sure enough, she called today. So
Good, good.
I'm
Yeah,
excited.
and I tell, and I I see there's so many, and again, I'm talking primarily about veterinarians, but I'm sure it's the same thing in humans. But there's so many Chinese practitioners that treat the conceptual diseases. It's like, oh, these are the herbs that I use for diabetes, or these are herbs that I use for Cushing's, or these are the herbs that I use for liver disease or whatever. And that's not Chinese medicine. It doesn't do that. So, it's like people that have dogs that have epilepsy, and they sit there and say, oh, what herb formula is the best for epilepsy? And it doesn't work like that. I tell people, I said, well, there's about 6 different pattern imbalances that can cause seizures in young dogs. And so you've got to identify which one of those pattern imbalances is for that particular dog. Otherwise, you're just wasting your time. So, you got 1 in 6 chance of guessing at it, And I see a lot of veterinarians, the same thing, that they just go to the book and they look up what herbal formula can I use to treat this disease. And I had an interesting scenario. I had a lady that emailed me 2 days ago, and she was I didn't know her, and she wasn't a client, but she wanted to do a consultation with me, and she said that she has a veterinarian that is just out of school, that's been out of school about a year, Chinese medicine, and her vet wanted to participate in the consultation as well to try to learn some stuff, and that's pretty cool.
Really?
Yeah. But unfortunately, I told her I was retired and I couldn't help her. So, but I emailed a lot of information for her vet that would help their dog. So,
Yeah.
Good for you.
Yeah. I know I went to an acupuncture, like a traditional Chinese medicine doctor, for some acupuncture this summer because I've had hives. And every time I go in our hot tub, they get really bad. So I have had to stay out. But anyways, I thought, I'm going to go for some acupuncture for this. And I was fully expecting him to go through all really get to the bottom of it and whatever. And he didn't. I ended up spending, oh gosh, I don't know. I went up to about 8 or 9 treatments at $100 each. And he did acupuncture. He did some energy work. And then he did acupuncture, like just the sites or whatever the places that I read about on Google. So I'm like, I think I wasted my money because he didn't want to.
That's not good.
Yeah, get go right to the source, kind of. Yeah.
I really think that human acupuncturists probably do a better job than veterinary acupuncturists do.
Yeah.
And the reason I say that is because think about it, if you want, let's say that you hurt your back and you thought, well, I think maybe acupuncture might help. And so you look up somebody and you find out somebody like you did and you go get treated. And so that person you went to is trained in Chinese medicine and acupuncture, and they have a deal on the wall that says certified in Chinese medicine, etc. Now, if your pet gets sick or hurts its back and you decide to get acupuncture, well, that acupuncturist has to be a veterinarian. You see, and that's a big difference. So there's no acupuncturists out there in animals that are not veterinarians.
Right.
And there are very few human acupuncturists that are physicians.
Yeah.
And it doesn't sound like a big deal, but it's a really big deal, because what happens is when you get educated and trained in veterinary medicine, conventional medicine, your whole perspective is based on Western medicine.
Yeah.
And that's why it's so hard to make that transition away from conventional medicine into acupuncture. But those people that don't have that conditioning and thinking about a Western medicine perspective, and then having to try to push it out of the way and get into a Chinese medicine, they don't have to deal with that. You see, and so that's why I think that so many veterinarians are unsuccessful in their treatment, and I just see it almost every day, It's really
Yeah.
sad.
Yeah.
Well,
Yeah, it's too bad. And there's so few anyways, at least in our area, like there's like probably nobody within 3 hours that will
Wow.
do veterinary acupuncture. So I just do myself with the essential oils.
yeah.
That's what
Um,
I'm doing too.
Yeah.
I
I enjoy
remember,
it.
I remember years ago, I had a really, really, really good client that used to come to me over in Coeur d'Alene, and she was one of the professors at Gonzaga, and she had this dog, and this dog was always getting into trouble, and one day it got into some porcupines, and so porcupine had quills all over it and everything. So she brought it in, and so I had to sedate the dog, and I was working back on the treatment table, and I was just taking out the quills, and she was there back there with me, and she had her high school son with her, and I knew him, and I can't remember what his name is now, but the whole time I was working on her dog, he was just coughing and coughing his head off. I mean, just kept coughing and coughing and coughing. And I asked her, I said, "What's going on, guys?" I said, "You really got a bad cough, you know?" And she said, "Yeah, he's been to doctors and specialists and everything, and they can't figure out why he's coughing so much. He's missed a bunch of school and everything, and now they're thinking that maybe it's some kind of weird virus or something, and they just nothing is helping him." And so anyway, I finished working on her dog, and then everything wrapped up, and they left. And I said, "Well, good luck with your coughing situation." And so about an hour or two later, I got a phone call, and it was her on the phone. And she said, "I was thinking, do you think that acupuncture might help my son's cough?" And I said, "Why not?
Mhm.
You told me that nothing else is working." So she said, "Well, who would you recommend?" And I said, "Well, the guy that I recommend is a guy named Howard Lee, and he's a block and a half on the same street that my clinic was on." And I said, "Give him a call. He's really good." And so later on, she called me, and she said, "I took him, and he did one treatment. 2 days after the treatment, he completely stopped coughing." She said, "That was it.
Yeah.
One treatment, and the coughing was gone." So, and I've seen that happen so many times from people that said, "Hey, do you think it would help me, or do you think it would help?" And it did. But the key is to get the right person. That's it, the right person. And Howard, I knew Howard just because uh, he was right down the road from me, and I went to him. But also, Howard he was Asian, and he was an acupuncturist. His father was an acupuncturist. So it just, I mean, it was a shoe, and he was really, really good at what he did. So anyway, well,
Yeah.
my goodness, it's already 5:15, and
Oh, wow.
we don't
You
have
got a
very
small crew, Dr.
Yeah.
Thomas.
That's all
I'm
right.
surprised. Yeah, some of our root people that never miss aren't here. So
Aren't you? Yeah.
yeah, well, why don't we go ahead and get started? It will just, a lot of before, I know Leslie's been here a long time, but a long time ago, I used to do a lot of uh, recordings on my phone, and just for references. And so what I
I think
wanted
I
to do
started
tonight is I
watching.
wanted to talk about heart disease so that we could have it in the reference file, because it's something that's really common problem in both dogs and cats, and it's not managed very well. There are a lot of mistakes that are made by the veterinarian, a lot of bad information out there, and I kind of wanted to go over that so people could be pre-warned in the event that you end up having a pet with heart disease, and then uh, you'll be empowered to make the right decisions. Okay. And so when you look back at history of the heart and how it's been handled with the healthcare situation, it's really interesting history. I don't know if you ever want to read something interesting, it really is. It's something, and it's not surprising, because when we think of the heart and all of its functions, then we kind of think of the heart, and we kind of think it's yes, it pumps blood, and it provides oxygen and nutrition to the cells, and et cetera, et cetera. But the heart feels like there's more to it than just that. You know what I mean? because so many things are focused on the heart, joy and love and all this stuff. And so everyone agrees that it's more than it just is muscular organ. And so there's always been this kind of taboo when it comes to working with the heart. And not just in Western medicine, but in alternative medicine as well. I know in Chinese medicine, for many, many, many years, they would not acupuncture the heart meridian at all. They would stay away. It's like, we're not going to do anything directly to the heart. And so they would circumnavigate around it and treat the pericardium to try to treat the heart. So even in Chinese medicine, they were really trying to avoid interfering with heart function too much. So in human medicine, the same thing. I mean, gosh, up until I think it was in the late 70s or early 80s when they did the first open heart surgery. And it was one of those things that, it was DeBakey and Denton Cooley in Houston that did the first open heart surgery.
Wow.
And it was the
I
same
didn't realize.
thing.
So recent.
Medical profession was like, no, you don't do open heart surgery. It was like opening Pandora's box. It was like, no, that we don't do that. And so when Cooley and DeBakey got together and did the first surgery, about 80% of the profession was saying, this shouldn't be done, and was raising a fuss and everything. But it's all history now because they do open heart surgery every day. But it was the same old thing. And when you look at the heart from a different other perspectives, it's extraordinary. I mean, we know. I mean, like even the heart chakras. We have the chakras in the body, and the heart chakra is where, as the energy moves up, then the heart chakra is where the energy where it changes from physical to subtle energy. Okay, so everything kind of moves through the heart and becomes higher dimensional. And so, and we all know the heart represents love. Love's unconditional, etc. Love is synonymous with God. So there's a whole lot more to the heart than just beating and pumping blood. And I think that we should appreciate that and keep that in mind. But tonight I'm going to talk about the heart as a physical organ and problems that we see and how we handle it if it comes up in dogs and cats. So I'm going to talk generalities. There are exceptions to the rule, but most of the time these generalities are going to hold true. So we'll talk about heart disease in dogs first. And as a rule, the smaller dogs, medium dogs, most of the time when they get heart disease, it's going to be associated with valvular dysfunction, valvular disease, okay? And so in most of the time, it's going to be a mitral valve insufficiency. One particular valve starts leaking. That's what we pick up with a murmur. And so most of the time, young, small and medium dogs, when they start having heart disease, again, usually associated in the beginning with mitral valve insufficiency. Okay. Probably 95 out of 100. Big dogs, large breed dogs, giant breed dogs, they don't have valvular disease as commonly. It's pretty uncommon in big dogs and giant breed dogs. Most of the time, when a big dog is diagnosed with heart disease, it's usually a cardiomyopathy, okay, which is a muscle. The heart muscle is not functioning properly, okay? So big difference between the two. And I'll use the human as example, even though I don't treat humans, but if a human goes in and has valvular disease, then they're detecting a murmur associated with it, that eventually what can happen, worst case scenario, is the valve ends up not functioning. They go in there, do valve replacement surgery, okay, and the patient can live. Cardiomyopathy in humans, on the other hand, they have no surgical intervention for that. Okay, and the medications for cardiomyopathies are poor at best, and so the treatment of choice for humans with cardiomyopathy is a heart transplant. And so that's anybody that's diagnosed with cardiomyopathy, that's what they're talking about, getting on the list already. And so, and so there's a lot of history with that. You get a lot of people that are actors and presidents and people that are renowned, they get cardiomyopathy and somehow they get moved up on the list and everybody's complaining, how did John Wayne get a heart that fast, when other people are having to wait 2 years? How is it that he only had to wait a week? Stuff like this. But so the point that I'm making is that with cardiomyopathy, usually the only treatment that's effective, again, is a heart transplant. And that's the same thing in animals. You have a dog that has cardiomyopathy, the medications that we use for them are very ineffective. And eventually that patient's going to die because we don't do heart transplants in dogs. So again, big difference between valvular disease and then cardiomyopathy. And again, so let's talk about what we see most commonly, and that's valvular disease. And that's where you go into the clinic and maybe the dog is in for its rabies shot or in for its annual exam or whatever, and the vet's doing listening to the chest, and the vet looks up and says, "Hey, do you realize your dog's got a heart murmur?" And of course, the client goes, "No, I didn't know that," and he gets all nervous and everything. And then typically, what we say is, "Okay, well, what we do is we grade heart murmurs from 1 to 6, okay?" And so as they get more advanced, then the higher the number. Okay, so, and it's like I don't know if you got any of the communication I had with Sabrina about that dog she was fostering,
Yeah.
and they said, well, it had a 2/3, and it was like, that doesn't make sense. It's either a 2 or a 3. It's kind of like saying this coffee mug is either black or it's blue, it's black blue. No, it's either black or it's blue. I remember when I learned how to determine what was the sounds of a in other words, any veterinarian, if I called a colleague of mine and said, I'm going to send you this patient, and this patient has a grade 3 systolic murmur, mitral insufficiency, then the minute that veterinarian hears grade 3, then he or she is going to know what that heart sounds like. Okay, it's just like, and that's what we do when we're in school and we're being trained. We listen to those. Back when I was there, we listened. We had an album, and we just listened to these murmurs over and over and over and over again. And then they would test them on us over and over and over again. So it drilled it in your brain. And so there's no maybe this, maybe that. If your veterinarian has been trained at all and at the level that they should be to assess heart disease, they shouldn't be able to differentiate between a grade 3, a grade 4, et cetera. So anyway, but basically what we do is we say, okay, your dog's got a grade 2/6. It's always 1/6 or 2/6 or 3/6 or whatever. So we say your dog's got a grade 2/6 heart murmur. And if I go into detail, I say I'm finding it primarily on the lower part of the left side. That's where the mitral valve is. So I'm identifying the location of it. I know the mitral valve's there, so I know that the valve that's leaking. So I know it's a grade 2. That's because of the sound. And the location, lower left side, that's where the mitral valve is. That's where I pick up the strongest part of the murmur. So I know that it's the mitral valve involved. So that's what I put in my record. Grade 2, mitral valve insufficiency, blah, blah, blah. And so it's no gray area. It's very, very matter of fact, okay? And then they say, well, what do you do? Well, there's nothing that we can do about it now. It's nothing to worry about. The heart's still functioning, and it is. It's still functioning. It's still doing its job. So what we're going to do is we're just going to watch, okay? So every time you come into the clinic, then we're going to listen to your dog's chest and then note any changes, So a year from now, you come in for an annual, hopefully it's still going to be a grade 2. You see what I mean? So we're just monitoring it. And basically that's it. And why is that? It's because we don't have anything to treat a grade 1 or a grade 2 or what have you. That doesn't exist. Okay. So if we had a medication that was for that, then we'd prescribe it, but we don't. Okay. So basically we monitor, and that's it. And so what happens is as time goes by, we monitor it. And so what we're doing is we're monitoring it and we're watching for symptoms of heart disease. Okay, because we told you all along the heart's functioning fine, nothing to worry about until it no longer functions normally. And then what we call that is decompensation. Heart can't do its job. Then we start to see clinical symptoms. Okay, so when we start to see clinical symptoms, everything's changed. Okay, it's now the heart needs some help. Okay, can't do it on its own. And so again, we call this the dog is gone, the pet's gone into decompensation. So depending on how bad it is, the chest might be full of fluid, might need oxygen therapy, Lasix and everything to get the dog out. Usually you end up at the emergency room, et cetera, et cetera. Then the minute that those dogs decompensate and start showing symptoms of pulmonary congestion, ascites, etc., all those symptoms that tell us, any of those symptoms that tell us the heart is no longer capable of doing its job, then that dog is then diagnosed as congestive heart failure. Okay. The minute that the dog decompensates, so the individual decompensates, they are defined as having congestive heart failure. Okay. Then we have medications for patients that have congestive heart failure. Okay. And they've evolved over the years. We used digitalis and stuff like that. Now the primary drug is they basically all work the same, but new is always improved. So the drug that's being used now is called vetmedin. And it's the same kind of drug we've used for years and years. It's just the newest one. So what we do is we put that dog on vetmedin. I'm talking about Western medicine. We put them on vetmedin if they need some Lasix diuretic. In other words, we treat symptoms as well, but the heart treatment is primarily vetmedin. Okay. So there's, again, if it's cardiomyopathy, we use different drugs. But the point is that up until the heart decompensates and they go into congestive heart failure, then we have nothing that is going to benefit that patient at all. Okay. So, and then the other thing is that research tells us that if that dog is in congestive heart failure with treatment, that dog's life expectancy average is going to be 6 months. That's it. And that hasn't changed in 45 years. Okay. It hasn't changed. All right. So I get these phone calls and I'm talking to clients and they say, my dog has got congestive heart failure. And I say, oh, it does. And they say, yes. And I say, how long has it had congestive heart failure? 2 years. Then I say, no, your dog doesn't have congestive heart failure. And they go, what? And I say, no, dogs that have congestive heart failure don't live for 2 years. Okay, so your dog doesn't have congestive heart, and they don't. You see, I wouldn't tell them that if they did, but they don't. And so what happens in those situations? I see it all the time. It's because these veterinarians, this person comes in and they listen to the dog's heart and they hear this advanced murmur. Maybe it's a grade 4 or something like that. In other words, it's really, the heart sounds like a washing machine, and so it's really a distinct advanced heart murmur, but it's not decompensated yet. Okay. And so veterinarians, our personality, our type, whatever you want to call it, is we got to do something. You know what I mean? This is a bad sounding heart. And so I got to do something for it. And so what am I going to do? I'm going to go ahead and start that dog on vetmedin. You see, I only got one drug on the shelf that's for the heart, and that's vetmedin. So I'm going to start giving this dog vetmedin right now, even though it hasn't decompensated. You see, in hopes it maybe just fooling ourselves that it's going to help, but it doesn't. You can even look at the website, the company that makes vetmedin. It says, do not start your patient on this unless it's shows symptoms of congestive heart failure. And so, but we do it anyway because we don't want to let them walk out the door without something. you see? And so we give them the only thing that we have. That would be fine, except for the fact that this drug comes with side effects, okay? That's why we don't like to start it until we have to. It's stressful on the kidneys, it's stressful on other parts of the body. So we certainly don't want to use it when it's not called for. And again, it's so common that people do that. Even the manufacturer warns everyone, do not do this. So don't let anybody put your dog on Vetmedin until it shows signs of congestive heart failure. It's just that simple. That's a rule. That's a big rule. And so the other thing too that when it comes to one of the things that I want to let you, okay, think about this. Think about this. If we only, let's imagine that you're the veterinarian and you have this patient, okay, that's got a grade 3 heart murmur, okay? So I know that I've only got one drug on my shelf that's going to benefit a heart, okay? One drug, nothing more, okay? So this is what we're seeing now, and it drives me nuts. And I even saw Sabrina say that, and it didn't surprise me because it's become standard protocol. Okay, so you go in and you take your dog in, and they say, "Oh, your dog's got a grade 3 heart murmur." Okay, and say, "Oh, this is what it is. It's probably mitral valve, etc." So instead of say we're going to monitor it, and explaining to you just exactly what I did, then what they're doing now is they're saying we need to send you to the cardiologist for an echocardiogram. And okay, that's become standard protocol. Okay, so what do? You take your dog to the cardiologist, you drop $1,000 to get an echocardiogram done, and you get this really nice report from the cardiologist that says you got a grade 3, mitral valve insufficiency. You've got a 2 millimeter increase in thickness of the left ventricle. At this time, there's no treatment recommended. So you dropped $1,000 for finding out a little more detail in what you already knew. Okay, and what they said is that there's no treatment for this right now, so no treatment's recommended. But let's see you in a year or 6 months, and we'll do another one. So here we're dropping $1,000 every time we walk in for an echo, knowing that the only drug we have is one drug, and the only time we're going to use it is when the dog decompensates and will show symptoms of decompensation. So why are we doing all these echoes? This, for the money. For the money. It's not telling you anything because we already know. We got one drug, and the only time we're going to use it is when they decompensate. And when they decompensate, they're going to show symptoms. I don't need an echo to tell me that my dog's got symptoms of congestive heart failure. So really think twice about having an echo done, because I just see it all the time. And it's really neat to be able to get all these measurements on the heart and everything, but it doesn't tell you anything. It doesn't tell you anything that you didn't already know, you see. So keep that in mind when they start recommending echoes. If the dog had congestive heart failure or something like that, then maybe there might be an advantage, or certainly if you have, but again, how's it going to alter the treatment? We only have one treatment. So yeah. It's not like, okay, the results of the echo show that drug A would be better than drug B or C. It doesn't work like that because we don't have options, you see. So that's what's really sad, is that we go through a lot, spend a lot of time, stress the patients a lot, and it doesn't change anything. So keep that in mind when you hear, because I see it all the time. Need to get an echo. Used to be needed to get an EKG, but now it's echo. And like I said, Sabrina, the other thing too, I don't know if you saw Sabrina, is I see this all the time, is that same thing. Go in and the vet says, "Oh, your dog's got a grade 2 heart murmur," and talks to you about the heart murmur and everything, sends you out of the door, freaks out, and then the dog ends up not having a heart murmur. Just like Sabrina's dog. Should I get on medicine? Should I start supplements? Blah, 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 whatever. I said, no, get somebody else to listen to the dog's heart and be thorough and make sure the dog has a murmur. And sure enough, they take it to the vet, second vet, and the vet says, no, your dog doesn't have a heart murmur. Well, how's that happen? Why does one vet say, but your dog's got a grade 2 heart murmur? Another vet says, no, you don't have a dog doesn't have a heart murmur at all. It's because, again, they're doing a shoddy job. They're listening to the dog's chest. Sometimes the dog's panting. You can never assess a dog's heart or lungs if the dog's panting. Okay. You got to stop it. So what do? You get your tech to hold the dog's mouth shut. Okay. And so cats purring. You can't listen to a cat's heart or chest if the cat's purring. So you put a little digital pressure on its throat right there, and the cat stops. So you've got to do these things in order to be able to listen to it accurately. Okay. So if you're listening to a heart and the dog's panting, then you're picking up those lung sounds, and they're almost the same time the heart's beating. And so what they're doing is they're picking up lung sounds and they're mistaking them for heart sounds. And that's why and I see that all the time, all the time, all the time. Just not being careful. And there's no way to prevent it, just to make sure that they're being accurate, and there's really no excuse for that. Just no excuse for missing that. But anyway, so that's why I always tell people, get a second opinion. And anytime it's a second opinion, somebody comes into a vet and says, I want a second opinion on a heart murmur, they're going to be very, very thorough. You see what I mean? They know they're the second opinion, so they're not going to miss anything. So before you start treatment for anything, just make sure that you know what you're dealing with. In cats, the primary problem we see with heart disease is associated with hyperthyroidism. The heart's beating too fast, so they end up with a cardiomyopathy. Because remember, the heart is a muscle, and if it's beating too fast, it's just like working out a muscle. If the heart's beating too fast, it's going to get bigger and bigger and bigger. And then these cats end up having secondary cardiomyopathies. And that's extremely dangerous. Those cats can die. And so, again, what we're doing is working with their metabolic rate to slow it down, slow that heart rate down, to take the stress off that cat's heart. So most of the time, it's rare to see valvular disease in cats. And again, the cardiomyopathies are mostly associated with hyperthyroidism. So it's interesting. We don't have a lot of heart disease problems in cats. And I've got my own theories as to why, but dogs, yes, lots of heart disease in dogs. Yeah. So, questions?
I have questions.
Sure.
Can you talk about the relationship of blood pressure to the heart?
Yeah, it's a two-way street. Inefficient heart is going to alter blood pressure. Okay, normal heart's going to provide blood pressure at a certain rate. I mean, a certain measurement. Okay, so if you have a sick heart that's not pumping like it should, then blood pressure is going to be affected by it. So heart disease can affect blood pressure, and then abnormal blood pressure can affect heart disease. You see what I mean? Same thing with the cats. Cats that have hyperthyroidism, they have really high blood pressures. Their blood pressure is, normal cat resting blood pressure is going to be probably 140, 130, 140. Hyperthyroid cats are going to be 200, 220. So their blood pressure is a lot higher. And so that is a contributing factor for the heart disease. So that's why I call it a two-way street. So blood pressure affects heart, makes the heart sick. Sick heart affects blood pressure, so it gets into a vicious cycle.
Right.
Okay.
So Sophie has high blood pressure, and we noticed it because her kidneys and her liver were showing, signs of distress and high blood values. And she's also losing protein in her urine, and we couldn't get the protein to come down until you had told me you have to check her blood pressure.
Right.
So we did find it was too high. So should I now be checking her heart?
No, I don't think so. One, they
Okay.
probably have Sophie on something like amlodipine or something like that for
They
the blood
do.
pressure.
They
And
do.
Okay, so that's going to bring that down and relieve the stress on the heart. But the other thing too is that thinking about blood pressure itself, okay,
Mhm.
then what we have to understand, again, a two-way road, is that the kidney can affect the blood pressure as well. Okay, so blood pressure can affect kidney, and then
Mm.
kidneys can affect blood pressure. Okay, and that's a catch-22 situation that clinicians get into, and they sit there and say, okay, we've got too much with hypertension, we've got too much pressure hitting the kidneys, which does structural damage to the kidneys. Okay, that's why it's losing. That's why they're losing proteins to structural damage. And so what they do is they say, okay, we've got to bring that blood pressure down to keep that from happening. But at the same time, we've got to keep it in the normal range, because if we reduce it too low, then we're not getting enough blood to the kidney to supply the nutrients and the oxygen that it needs for healing. Okay, so it's a fine line. And that's what we're trained to do. So yes, got to get that down. But again, kidney disease can affect blood pressure. We call it renal hypertension. And so it's a two-way road. So we have to sit there and say, which one's first, the chicken or the egg? You know, was it the kidney disease that caused the blood disease? The blood pressure was the blood pressure that caused. Same thing with the heart. Was the heart caused the blood pressure problems, or was the blood pressure caused the heart problem? That's where you have to put your thinking cap on. Okay.
Yeah.
Looking at your history, looking at your patient, and falling into those categories, you know?
Yeah.
So,
And then what was the cause before that? Which we think we've got leaky gut that contributed to kidney, that contributed to blood pressure, is what we think's happening. But what's so crazy is she's never had any outward signs of like symptoms of leaky gut. But we know like the pancreas numbers were slightly elevated. And so it's interesting. I'd also love your thoughts on the wood element as it relates to, like, I immediately go to high blood pressure because of the personality of a wood element. But what are your thoughts on the wood element as it relates to the heart and blood pressure?
well, and again, I'd like to look at, when I'm understanding how the body's working as a whole, I usually go to Chinese medicine, because in conventional medicine, we don't connect the dots. We do a really poor job of connecting the dots. And so when I go look at Chinese medicine, and I'm, are you saying the blood pressure? Okay, so the heart blood pressure. So what we're looking at is we're saying, okay, how's wood affect the cardiovascular system? Okay, well,
Mhm.
wood element is the mother to fire, and fire is the heart. So I
Mm.
obviously imbalanced liver, which is always going to be a yang excess. So it's going to be an excess pattern. Okay. So you very rarely have a deficient wood imbalance. You usually have an excess wood imbalance. So you've got too much yang. And in Chinese medicine, if you have too much liver yang, because it's the mother element to fire, then usually that leads to a heart yin deficiency. So most heart disease that's associated secondary to liver imbalance is due to that. So in other words, if I've got a heart patient that's a wood element, and I ascertain that it's out of balance, which most of the time it's going to be, then not only do I have to work on the heart, but I've got to work on the liver as well. Otherwise, you know what I mean? It's that the liver is what started the whole problem. If
Mm.
I don't address that, then the best that I'm going to do is to keep it at bay, but I'm not going to get resolution.
So
Okay.
should I be paying? So she did have high liver blood work. And we got her on some herbs, came down like right away. It hasn't been high since then, but should I be paying extra attention to her liver?
Of course, certainly if she's a wood element, because that's
Mm.
her predominant
Okay.
organ, and that's what's going to orchestrate most of the things. Okay. And you're talking about the influence of you're saying, okay, well, we didn't have signs of leaky gut, maybe some elevated pancreatic enzymes, but again, nothing in blood work is going to assess leaky gut, pancreas, or anything. These are all maybes. Even when you look at the lab reports, they'll say lipase and amylase are elevated, could be correlated to pancreatic disease according to what the symptoms are. In Chinese medicine, what do we know? We know that the wood element is the mother of fire. So what it means we can have heart disease, energetic and physical. Okay, what do we see? Our energetic heart disease. We see shin imbalances, which usually are anxiety, stuff like that. So we get those emotional disturbances. All right. But what else do we know about the liver and its influences on the body? Is that what we call the co-cycle, that the liver is the grandfather of wood. I mean, not of wood, but of earth. So what does that mean? It has a regulatory effect on the gastrointestinal system. You see, so the two major organs besides the liver itself that it has major influence on are the heart and the GI system.
So to really nurture the liver, what would be some tactics? Like I've heard people say, like feeds like, so should I always make sure she's intaking liver in her diet?
Now, again, I am always focusing on healing, and healing can only, in my opinion, can only be done from my perspective of using Chinese medicine, okay? Because Chinese medicine is all about reestablishing normal health and well-being. Conventional medicine has never been like that, okay? So we have to go back to that. So we have to sit there and say, hey, okay, how do I get this wood element back into balance and also treat those things that that patient's liver imbalance has caused? Maybe it's caused emotional disturbances. Maybe it's caused heart disease. Maybe it's caused GI upset, problems. So, okay, so I'm going to have to treat all of those things that imbalanced liver has created, and at the same time be working on reestablishing balance of the liver. And that can be done, okay? And that's the Chinese practitioner. That's our job to do that. We call those the root imbalances. It's like I've said all the time. It's like peeling an onion. Those outer layers are the ones that are saying, oh, I've got a dog or a cat that's vomiting all the time. What do we know vomiting is? Vomiting is called rebellious stomach chi, and it's always involving the liver, okay? Because the liver is responsible for proper movement of chi. So if the vomit's going out instead of the food's going out instead of downstream, then we've got liver chi rebellion that's going back. So the liver is obviously involved. So boom, we know we got to fix not only the stomach scenario, but we got to fix the liver. Okay, so let's say we do that, and we're peeling that onion, and we get down to the bottom and say, oh, we got an unhealthy liver. So we work on that. Pretty soon, we got this patient back to normal health and well-being. Life is good. Okay, eating a good diet, been on herbs, now got everything back in the balance, and we got a happy patient. And I can't count how many of those that I've seen over the years. And and hopefully they're not so old that these things have been going on for years and years and years, and we run out of time. And that's our cancer patients, et cetera, et cetera. So, but anyway, so we get them back in the balance. Life is good. Everybody's happy. The patient's happy. Everybody's happy. And then all of a sudden, a year down the road, year and a half down the road, all of a sudden, this individual starts getting sick again. Maybe some of the same symptoms, maybe not, maybe something different. And so you've heard me tell the story before. They call me up on the phone, say Fido's sick again. It's been doing fine. It's great. It's all everybody. Now all of a sudden it's sick. And so I pull up my file and say, this is a wood element. What do we know about wood? Wood elements do not like stress. To define a wood element, they want to be in control. If they don't feel like they're in control, they get stressed, and then bad things happen if it persists. Okay. And I'm not talking about 99% of the time, 100% of the time, I sit back when I see it's a wood element, I'll say, okay, talk to me about the last 6 months or a year. What's been going on in your house? What is the stress that's been going on that's creating stress on this dog? Because stress is why your dog's got sick again. And every time they'll sit there and say, yeah, well, my husband was diagnosed with cancer, or my child's been sick and we've been going through a lot of problems, or my husband and I have been fighting, we're talking about a divorce, something going on in the environment that's created stressful energy. I'm not talking about discussions and stuff. I'm talking about the energy itself that has been created from this stress has affected that dog, and that's what's brought things back to the surface. So when I have a wood element that is caught out of balance, 9 times out of 10, it's due to stress, environmental stress. They cannot tolerate things not being, they've got to feel like they're in control. It's just,
Yeah. Yeah, no, she's super responsive to any little thing.
yeah.
Yeah.
So I
Okay.
tell people that for wood elements to keep them in balance, you've got to focus on good energy. I mean, if there's problems going on in the environment, couples have been fighting and stuff like that, you got to sit down and have a heart to heart. And then I'll go so far as to have people smudge their house. Smudge your house, get rid of that negative energy.
Yeah. I need to do that
Makes
again.
all the difference in the world.
Yeah, I do it every now and then. I haven't done it in a while.
Yeah, people forget about it. People forget about it, but I mean, really, I mean, energy doesn't leave. It doesn't. It's not like smoke. It doesn't just dissipate. It stays there. I mean, you walk into go to Europe and go into some of these churches that have been around for 2,000 years, and you walk in there, and the feeling that's the energy in those churches are mind blowing. It's because it's just an accumulative, and it doesn't dissipate, And that's the same thing with negative energy, because there are very few households, especially here in the United States, that there's not negative energy on occasion, and it's just there. It hovers, and it becomes part of our energy. And so we need to focus on the energy, healthy energy in our environment ourselves. That's why when we smudge, what is the first thing we do? We smudge ourselves. Smudge ourselves, and then we smudge the premise.
Yeah. We went to San Francisco a few years ago and did the Alcatraz tour, and oh my gosh, you could just
I'm sure.
I could
feel the energy.
Feel it. Yeah.
John and Steve were just here. I mean, John and Scott were just here, and they did the Alcatraz deal too at the same time.
Yeah. And also there's another one. It's in Montana. I think it's is it Deer Lodge?
Yeah, the state prison. The state prison. Yeah.
And we did that a few years ago, and
it's scary. Yeah. It's scary.
It is. I could just
you go into that prison, and it's like, oh my God. Oh my God. Yeah. Yeah. You can tell. Yeah. We used to, I had my kids over, my youngest daughter used to be enamored with this ghost stories. She loved to read about ghosts and everything. And there was a place we took a trip to California, and there was a place that had a renowned ghost place where the ghost lived. And it was freaky. You could go in there and feel that energy. And they were telling us about this house. Somebody had built this house. It was a 2-story house, and about the ghost that lived in this house. Nobody lived in it anymore, but it was for tourists and everything. And then she was telling us that the reason there were ghosts and everything was because before they built this house, it was a cemetery and a place where they hung the criminals.
Oh yeah.
Yeah, so they did all their hanging here and then buried them, and so then they come along and build a house on top. So imagine the energy there.
Ooh.
So, yeah, pretty creepy. So we forget about that, and it's vitally important for health.
For a dog.
Again, I know I've talked about it over the years that we know that each cell in our body is affected not only by the biochemistry but by the energy. And Bruce Lipton's proven that the energy has got 100 times more powerful influence than the biochemistry. So we can't ignore the energy, the energetic influence. You look at the studies that have been done, and one emotional outburst that a person has, and if you look at the physiological events that happen because of that emotion, it's scary about all the negative stuff that it does to your body. Physically, So we've got to stay on top of the energy, especially if they're wood element individuals.
Yeah, I feel like I just can't get her in a stable state, and I have not smudged this house ever. We moved in 4 years ago. I should smudge it. I will smudge it.
Absolutely.
Yeah, I just wrote myself
smudging around
note.
Cats. If you've got cats, you can't smudge in the same room that cat's in. So
okay.
But people should. I had some friends of mine that owned a restaurant and kind of a restaurant deli, and they would smudge their place every morning before they opened. every morning. It's pretty
That's a
cool.
good idea.
That is cool.
Yeah.
Especially you're opening it to the public. Yeah. Bringing in all their
And-
energies.
Yeah, and you can't control who's coming in.
That's
and,
right.
Yeah.
That's right. So
Yeah.
anyway, any more questions?
So okay, to recap, keeping the liver in balance, would you say that it's not only, or anything in balance really, it's not only looking at blood work, it's also looking at outward symptoms, right? And trying to let, the energy, the symptom, the patient tell the story, right?
Blood work is so inefficient at picking up things.
Okay.
Blood work. I'll give you an example. Years ago, back before we had ultrasounds and stuff like that, I remember again, same thing. I had done blood work, and this dog's liver functions were perfectly normal. All the liver functions were normal. Okay, everything was perfectly normal. And I felt an enlargement in this dog, so didn't have ultrasounds back then, everything. So I had to do an exploratory surgery. Went in to open that dog up, and this dog's liver was almost 3 times normal size, and 99% of it had cancer in it.
Ooh.
Solid cancer,
Mhm.
completely malignant cancer, and the blood work was perfectly normal on this dog.
Oh.
Yeah.
Perfectly normal. So I can't tell. I had a dog come in that was sick, red blood work on it, nothing. Vomiting, abdominal pain, the whole 9 yards, nothing. Blood work perfectly normal. Next day, was in the hospital on being supported, IV fluids, etc. I decided to run blood work again the next day. If I talk a client into spending another $100 on a blood profile, and I said, something's going on here and we got to do some more blood. Well, you did it yesterday and it was normal. Yeah, but we're going to do it again today. Did it again. Pancreatic functions were through the ceiling. I mean, in less than 24 hours, it went from normal within the 120 range up to above 1,000.
And that was after being supported by fluids.
After treatment started. Yeah. So
Yeah.
blood work can be so misleading. So misleading.
Okay.
When it comes to the GI system. Because
Okay.
you can have cancer patients. I can't tell you how many cancer patients I've seen. Inflammatory bowel disease, leaky gut, all that stuff. None of that stuff's going to show up on blood work. None of it. Absolutely none.
Okay. Yeah.
So it's one of those things that, it's like before we started doing SDMA, when we did kidney functions, we used creatinine, and creatinine doesn't even elevate until 75% of the kidneys are diseased.
Yeah.
So
Yeah. And by then it's,
what good's the
Yeah.
blood work doing you?
yeah.
Yeah.
So
Yeah.
fortunately, it's improved some over the years. We've got SDMA now and stuff like that, and it's helped, but it's still we get blood work back and we tell the client, oh, blood work looks good, and everybody's happy, and then 2 weeks later the dog's vomiting and the dog had cancer. They say, well, you just did blood work, you just did it, and you told me everything was fine. It's just, if you pick up something that is blatant, like a creatinine is 4.5 or the liver enzymes are through the ceiling or whatever, then you sit there and say, wow, we got a problem here. But then it comes back normal. It says the blood work looks normal. And if we've got a normal acting patient, then chances are things are pretty good. But that's it. And I tell people this all the time. Because of the way we think in conventional medicine, is that in other words, conventional medicine says unless you're sick, then you're healthy.
Mhm.
Okay. And so we're not going to do anything until you get sick, and then we'll address it. Okay.
Yeah.
And so we're conditioned to believe, well, my dog is not sick, and so it's healthy. No, there are very few dogs and cats out there that are healthy. There's this big gray area between being healthy and being sick. And that's where they all live, is in this gray area that's saying, I'm not healthy, but I'm not sick yet. You see? And conventional medicine doesn't do anything for that gray area.
That are in that, yeah.
And that's why I like Chinese medicine, because we can pick up those unhealthy patients before they get sick. Back to the heart scenario. So let's say, same scenario. You go into the vet, and vet says, oh, you got a grade 3 heart murmur, and it is a grade 3 heart murmur. Say, we don't have any medicine, so we'll see you back in a year. You go into the veterinarian that does Chinese medicine as well, and they say, "Oh, your dog's got a grade 3 heart murmur." Oh, guess what? I've got something that I can do for your dog's heart. We're going to assess it from a Chinese medicine perspective. We're going to put it on some herbs right now to address the imbalances that have created that situation. And then we're also going to put on some herbals. And so what most of those dogs that have valvular disease, I start those dogs on herbal formula called Zhu Fu Zhu Yuan or Blood's Palace by Cons Essential. I put them on hawthorn berry and I put them on ubiquinol, which is the active ingredient
yeah,
in
right.
CoQ10. So those three, and I can't tell you how many patients that, oh my God, the valvular disease went away.
And they can, the dogs can stay on hawthorn berry and ubiquinol indefinitely, right?
Until the heart is back to normal.
Okay.
Yeah.
Because I have Sophie on that too. The last I knew, we were still losing some protein in the urine. And
They just
obviously she's
healed
still
yet.
displaying, do what?
Haven't healed yet.
Yeah,
Okay,
she's still
let's look
displaying
at that
signs.
scenario. So you get a dog that comes in and they pick up the elevated kidney functions and they say, "Oh, your dog got kidney disease," which means nothing that other than your dog's got sick kidneys. And so then we find out what's causing the kidney disease. And so in your scenario, they found out the dog did a urinalysis, found out your dog was losing protein. So they probably did a urine protein creatinine ratio, saw that that was elevated. And so they got a diagnosis of glomerulonephritis. And so what do we know about glomerulonephritis? We know it's always secondary to something else. And so we start looking for that something else because if we don't deal with it, then the kidneys are never going to get well. They're going to continue to crash. And so the first thing that we do is we check blood pressure for hypertension. And then if the veterinarian's clever enough, in which let's just say they don't think about it because they haven't read the research, and that's that link between chronic GI inflammation and glomerulonephritis. And about 80% of my patients over the years with glomerulonephritis had chronic GI inflammation. And we know the pathophysiology of that is that the inflammation going on the GI system creates what we call inflammatory cytokines. They get into the bloodstream, go into the kidneys, create an inflammatory process, and that's when we get the glomerulonephritis. So even if the veterinarian is clever enough to figure that, connect those dots, and then they sit there and say, "Oh, okay, I've got a dog here that's got chronic pancreatic inflammation, and that's what's triggering the glomerulonephritis, and I've got to treat the pancreas, while I'm supporting the kidneys to get this patient to heal." So how am I going to treat the chronic pancreatitis, the chronic pancreatic and GI inflammation? Guess what? We don't have a treatment for it.
No.
There's no such thing. So what do they do? Dogs that have chronic pancreatic inflammation, we put them on a prescription diet that's low in fat, which is, yes, they do need low-fat diet, but that prescription garbage just creates more inflammation in the pancreas and in the gut. So it's a catch-22 situation. So you cannot solve that problem from a conventional perspective because we don't have a treatment for chronic GI and pancreatic inflammation, you see? But we do in Chinese medicine. We've got these herbs that will address that pancreatic and GI inflammation, okay? Along with the fact that we know that the food we're feeding is creating inflammation. So we get them off the pro-inflammatory diet, put them on a diet that's not creating inflammation, and then we repair the damaged gut. And then guess what? That patient that was given 6 months to live, heal, and they live happily ever after. Happens all the time.
Yeah.
It's that simple.
Yep.
Yeah, hers has been interesting because she's not really ever shown any like GI, the common GI issues in terms of diarrhea or constipation or even like flagellants or any of that. Like she's always been really easy from that perspective, but always had allergies.
Yeah. Well, remember, you cannot have allergies without leaky gut.
Yeah.
Yeah.
It's a precursor.
Yep. So it just I wasn't associating because you didn't see any other like GI issues. that was the case.
Yeah, but if it
But that
walks
makes
like a
sense.
duck and quacks like a duck, again, when somebody tells me their pet's got allergies, you absolutely know they've got leaky gut, and leaky gut means gut inflammation.
Yeah.
You can't
Yeah.
have one without the other. It's just
Yeah.
that simple.
No, it makes sense.
But
It
if
makes
you went
sense.
in and if you went into 100 veterinary clinics and talked to 100 veterinarians and asked them how prevalent leaky gut is in dogs and cats,
They
90% of them would say it's not a problem.
Yeah.
And there's not a patient out here, there's not a dog and cat out here in the United States that probably doesn't have leaky gut.
Yeah.
And it is the precursor for almost all chronic diseases, and we are totally ignoring it in veterinary medicine. Totally ignoring it.
I put her back on the 3 seeds.
Yeah, good.
So, yeah. And you had originally said the grapefruit seed extract.
That's to kill the yeast overgrowth. Yeah.
Okay.
And
So,
usually we get those killed, and we're feeding the right diet. We generally don't have to leave them on it.
yeah. Okay.
Remember, because those yeast, they thrive on that conversion into sugar. They require those deleterious starches.
Yeah.
So we starve them, kill them with the grapeseed or whatever. Cat's claw kills. There's a lot of things that kill yeast in the gut. But the point is, we put them on a healthy food. Those yeast aren't going to grow back. They can't. They don't have anything that they can survive with.
She is someone that's also prone to like the little red itchy sores on her skin too, like a yeasty skin for sure. So do you think it's reasonable that I could kind of assess her yeast situation in her gut by what's happening on her skin?
Yep.
Okay. Okay. So if I'm seeing her skin having those like yeasty spots, then maybe I should be using the grapefruit seed extract.
Yeah, probably a good idea.
Okay.
Ears, whenever you're dealing with yeast, you're almost always going to get ears involved too.
Yeah, no, we've had struggles with her with that too. And do you have any concerns about grapefruit seed extract with the high blood pressure and on the blood pressure?
No.
Okay.
No.
Okay.
And there's others. Grapefruit seed extract is just available. Everybody can get it. Everybody, there's other cat's claw. Cat's claw is really good, kills yeast. It's really good for gut inflammation too. So that's another supplement too.
I'm wondering if I shouldn't do a little thing like your gut protocol for Katie again. I had switched her this summer over to a gently cooked
yeah, that's fine.
food.
But Leslie, before you move on, let me ask you a question. Okay. What is it that you just said? You said, I'm wondering if I should do something to address the gut again. So how are you going to answer that, yes or no?
I think if I'm wondering it, I think I should, because
well,
I feel like
okay. Come on now.
she's got I just feel like she's got a lot of these symptoms now. When I switched her from that gently cooked, and now I have switched her back to raw. Yeah.
Oh yeah, been doing.
Yeah, just like the smudge. I have my note up for smudge.
Should Katie get her gut treatment? Look.
Okay. Yeah, and I do that all the time. I
haven't done the pendulum yet. I need to get a pendulum and do it.
So that's why I interrupted you, because I know you use it routinely.
I do.
And I'm wondering why you haven't done it for this.
Yeah. I've just been really, worrying about her with this, like her acid reflux, which I think is getting better. But then she lays on the couch at night and she pants really hard. And I think that's maybe, it was worse before I started on the Pepcid AC. I mean, she's not on it now. I did it for 4 days. But that was because she's in pain.
Yeah.
Yeah, that's what I figured. And
why?
That was
because
probably,
we know when they're lying down, it's putting pressure on the abdomen, and that's when it hurts.
That's when it hurts. Yeah.
So that slippery elm or marshmallow extract should help with that.
Okay.
Oh, I love.
Yeah, I'm doing the marshmallow now, and then I got her on those other herbs that you recommended for the gastric reflux, the I can't remember the name of them now, but anyways, so I've got her on that. But no, I'm gonna I feel bad because I was the one who kind of messed up her little diet situation. And her breath is just so awful all the time.
Well,
So,
that herb will take care of that.
okay.
Yeah.
Okay. Yeah. Yeah. Other than that, I don't know.
That
She's-
rotten breath is just telling you that things are stagnating.
And exactly. Yeah. 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 And I think that is, I did have the hormone. Yeah. Yeah. And she's had a few more seizures once in a while. Like they just happen out of the blue. She'll go months without, and then she'll have one. And so she had two, I don't know, one this month and one last month. They're so short and mild. They're, like they're not, they used to be a lot more, they lasted longer, and she would really have big tremors. Now it's almost I don't know, like way less. Like they were just way more mild. And I haven't. I know before I was pretty sure stress was causing it. Just because that's when I was sick, Brian was sick, and I'd had my surgery, and we had so many people in and out of the house bringing us food and everything that it really bothers her when she has to, protect the house as much as she had to. So.
So what have you been using for those seizures?
Calm Repose and GABA. Now, the other thing that I started doing, I was giving her 500 of GABA with breakfast and then 500 mg of GABA before she went to bed. I switched that bedtime one to give to her with her supper. So she's having it before the, evening when we're, and she always has them when we're like just relaxing, when it's quiet.
Yeah, I want you to energy test that Calm Repose.
Okay.
Yeah.
Okay.
That should be taking care of that.
I wonder, yeah, maybe I should. I know I can't remember what the dosage was. Maybe I should, just check. I'll energy test it and to see if
energy test.
I need to up the dosage, maybe.
And then energy test the dosage too.
Yeah.
Okay. Because that should be the herbal formula of choice for her.
For her, yeah.
For those seizures. Yeah.
Well, and honestly, I feel that I always think it's working to some degree, because I'm thinking, well, if I took her off of it, she could be having seizures like constantly.
Yeah, but if she's having them, it means she's not healed yet. Yeah,
that's true. I'm just gonna write that down.
That's why, and you've heard me say this before. People say, I'll be reviewing a file and I'll say, well, you didn't say anything about your dog having hypothyroidism. Oh, so that's not a problem. And I say, it's not. And I say, no, we're giving Siloxane or something for that, and it's been completely controlled. I said, so what happens if you take your dog off the thyroid supplement? Oh, then we got a problem. So it's not fixed.
So it's still, that's right. I mean?
Yeah. Same thing.
Right. Yeah.
In other words, we don't want them on anything.
Yeah.
We want them fixed.
Yeah.
Okay. All right.
Okay.
Anything else? Well, I'm sorry we didn't have better
Thank
turnout.
you.
I'm kind of surprised.
Hey, Leslie and I loved it. We got
Yeah,
your
it was
undivided
great.
attention.
All right, guys. Well, thanks
It
for
was
coming.
awesome.
Thanks
Well,
for
thank
joining.
you.
Have a great evening. Namaste.
Thank you. Namaste.
Okay. Bye.
Bye.
Bye.